さて、村松さん、一つ目のテレヘルス、早速行きましょうか。
はい、テレヘルスですね。これから15分の英語ビデオを始めますが、女性の視聴者の皆様、お待たせいたしました。アドバンテック社内でもはや商品ではなくて、俊海くんのファンが増えそうじゃないか、などと持ちきりになっております。
俊海くんですね。
はい。
はい。確かに彼、高青年なんです。ただ、村松さん、俊海くんの話より、今日はインテリジェント行きましょう。これでしょ？インテリジェント。はい。内容の方に行きましょう。
そうですね、木下さん。今からお伝えする内容はテレヘルス。いわゆる遠隔医療の市場が急速に拡大している状況を皆様にお伝えして、そのニーズに対応するアドバンテックのソリューションと事例を共有いたします。
はい、いいですね。日本国内でもこの分野は連日のようにテレビだったり新聞などで出てきますね。特に国内の場合は居住地が広範ですし、コロナ、高齢化、こういった課題に対してこのテレヘルスを必要とするニーズというのはますます高まっていますね。
はい、そうです。海外でも状況は同じです。動画の中でも出てきますが、木下さんのおっしゃったような要因と 5G などの新技術の採用により、今後5年間で倍になるような市場拡大が予想されている分野になります。
はい。アドバンテックって、そういった分野でもしっかり製品展開してるんですね。本当ソーシャルニーズがあるところ、どんなとこでもやってますよね、アドバンテック。
本当ですね。
はい。皆さんお待たせしました。まず、テレヘルスの市場拡大について、俊海くんの説明スタートです。俊海くん、よろしくお願いします。
Hi everyone, my name is Junkai, and I am the Business Development Manager for Telehealth Business in Advantech. It's my pleasure to be here, and I would like to introduce you our telehealth solution. Telehealth is a method of providing medical care remotely, usually through video chat. Telehealth makes it possible to connect patients and clinicians from any location. It provides access to a wide range of care, including primary care consultations, psychotherapy, physical therapy, and even emergency services. By allowing primary care clinicians and specialists to further their reach and treating patients wherever there is an internet connection. Here I listed 6 benefits of telehealth for healthcare providers and patients. The first one is Advance's new business models, which means telehealth is shifting the paradigm by advancing consumer-based care. Doctors can extend their patient base beyond the physical facilities and create more convenient services for their patients. The second one is improves patient engagement with remote monitoring, which means healthcare providers can act like the coach and interact with patients to improve their health outcomes using telehealth. The third one is expand access to care and reaches more patients. Well, we know there is an increasing physician shortage. Telehealth can be used to reach patients in rural areas and outside the normal care delivery systems. The fourth one is improves clinical workflows and increasing practice efficiency. Telehealth can be used for quicker prioritization of care delivery, triaging each case and improving communication for better medical decision-making, which also allows patients to save a lot of waiting time during a visit. The fifth one is increases practice revenue and cuts cost. Telehealth is less time consuming both for healthcare providers and patients, and it cuts down no-shows. In fact, many hospitals are struggling with frequent no-shows because rural patients don't want to drive for many miles only to receive care at the facilities. So telehealth can improve no-show rates by 50% and reduce the cost compared to traditional visit. The last one is improves healthcare quality and patient satisfaction, which means telehealth can improve the convenience of receiving treatment by allowing patients to receive care without traveling long distances. So the quality of care will not be compromised and the readmission rate will also decrease. There are 3 major drivers for this fast-growing market. The first and the most recent driver for telehealth has been the global COVID-19 pandemic. Strong social distancing and minimal physical contact precautions have pushed the shift to telehealth and remote consultations as it adds in infection protection. These precautions and the increased hospital bed shortages have forced medical facilities to incorporate more telehealth technologies to keep up with demand and maintain care continuity for patients at home. The second driver is the shortage of medical professionals, when demand is increasing every year due to an aging population and more patients with chronic and non-communicable diseases. For people living in rural areas, their medical demands are underserved due to insufficient resources and long distances to drive into cities for care. With this surmounting pressure, healthcare providers have started to embrace digital technology to enhance care delivery efficiency. Telehealth is one of the promising ways to tackle the challenge of doctor shortages and expand specialists and doctors' reach to patients. And the last one is 5G technology. The three features enhanced mobile broadband, mission critical communications, and the massive IoT ensure the quality of connectivity and expand the possibility for wireless application in healthcare industry, especially for medical images transmission, which is the core of telehealth. Along with the telehealth market trend, Advantech starts to provide telehealth solution for our customers. Basically, our telehealth solution is providing medical professionals with a telehealth card, or it can be seen as a mobile workstation that is equipped with a video conferencing system and a medical computer and a battery system. The video conferencing system features a high-quality PTZ camera that supports full HD resolution and 18 times optical zoom, and a high-quality speakerphone that supports digital signal processing technology and echo cancellation, which allows doctors and patients to see and hear each other very clearly, even they are not at the same place. The telehealth card has a clinical-grade panel computer with a wide touchscreen, which is specifically designed for medical environment, and it supports fast data transmission and data computing. The work surface of this card is waterproof and dust-proof, and it's really easy for daily decontamination. It also has a drawer to store some documents or medical devices. And this card features electronic height adjustment so that it can be used in a more ergonomic way. As a mobile workstation, this telehealth card has a battery system with 8 to 10 hours battery life, which means medical professionals can use this card without charging during a whole shift in hospital. And the battery power can be even monitored remotely by intelligent power management software. With this mobile workstation, medical professionals and the patients can connect with each other to provide healthcare services anywhere and anytime. No matter it is for inpatient care like emergency department, ICU, isolation room, or routine ward rounds, or outpatient care like rural area or community clinics or health center. Even for long-term care, our telehealth solution could be well applied into these scenarios. So, why do healthcare providers need this telehealth solution? For example, medical professionals can use telehealth card to do virtual ward rounds in hospital, which can save more time and expand a doctor's capacity to care patients. Virtual ward round is more and more popular around the world. And our solution can help build virtual clinic in rural areas to increase their accessibilities to medical resources. For ER and ICU, telehealth solution can fill the staffing gap and reduce patient waiting time by virtual cooperation between bedside staff and remote care teams. Telehealth solution can also protect medical professionals from infection by reducing the frequency of entering the isolation room, but still can give treatment to the isolated patients. Last but not least, Medical education like surgery demonstration or medical conferences can be assisted by telehealth solution to maximize the effectiveness. Besides telehealth card, our solution also includes a video conferencing software which is HIPAA compliant that secures patient data and patient privacy. And it also supports remote camera control, remote annotation, unlimited screen share, and video streaming from third parties' medical devices like digital exam scope, EKG, or ultrasound. Our solution also includes a digital exam scope, which is comprised of one control unit and 3 exchangeable lenses like general scope, otoscope, and dermatoscope. The images can be transmitted in real time, which gives doctors at the remote site more evidence for more precise diagnosis. Now let's take a look at our telehealth solution product video. Please enjoy the video. Here I prepared 4 use cases for you to have a deeper understanding of how telehealth solution works in the real world. The first one is in Taiwan, and it is a teleconsultation in rural area. In rural area, most diabetic patients are elder people, and they have to travel a long distance to have regular eye examination at medical center in urban area, which is very time consuming and exhausting. With our solution deployed in rural health centers, patients can easily access specialists to have eye examination and get treatment recommendations by just visiting nearby health centers. The second use case is also in Taiwan, but it's dermatology teleconsultation in mountain area. The concept is quite similar to the first case, which our solution is deployed in a community clinic that allows the residents in the mountain area to access the dermatologist directly. And the third case is in the Middle East, in Qatar. And there is a large medical corporation called HMC, which operates 9 hospitals in Qatar. According to the report, HMC received around 1,600 stroke patients every year. Unfortunately, the number of doctors is insufficient to support each hospital to give immediate assessment for stroke patient because there are too many patients waiting in the emergency room. So HMC placed our telehealth card into the emergency room in each hospital and used the telehealth card to connect a centralized remote stroke team to do patient assessment and get treatment advices. In this way, HMC increased the efficiency for handling stroke patients without hiring more medical professionals. And the last case is in the US. There is a large health system called Banner Health, which runs 28 hospitals across 6 states. Even a large health system like Banner Health is still facing the physician shortage, especially in the ICU. So that put our telehealth card on the bedside in the ICU, so the bedside nurse can cooperate with the remote physician team through our telehealth card to give a joint treatment for patients. In this case, the benefit of telehealth solution is very obvious, that is, increase the efficiency but reduce the cost. Besides telehealth card, we are offering telehealth suitcase as well. This portable suitcase could support more extensive telehealth application, especially for on-site services like emergency care, home care, and military medicine. Although Advantech's telehealth solution already combines hardware and software together, we could also offer standalone hardware platform. So we are really welcome and look forward to partnership with other system integrators or individual software vendors for telehealth. In this way, different partners could bundle their software with Advantech's hardware to build a total solution and create more diverse options for healthcare providers. So, if you are interested in our telehealth solution, please feel free to contact me for more information. Thank you.
いやー、チュンカイくん爽やかで、英語もわかりやすいし、羨ましいな。お姉さんにモテそうなイケメンでしたね、木下さん。
はい、確かに、スーツ姿も決まってて、いい青年だったんですね、彼。
木下さん、シュッはそうではありませんよ。こうです。シュッ。はい。シュッと素早くですね。こうやってシュッと。
いや、村川さん、それもう僕には無理ですね。もうそれいいから、内容の解説の方行きましょうか。
そうですね。
内容の方に。
はい。
シュッと。はい。
そうですね。失礼しました。はい。このテレヘルス市場ですが、コロナ影響が確実に加速のドライバーとなっていまして、そこに 5G が加わって、高画質で低遅延の映像が気軽に共有できるようなことが影響して、日々進化拡大してきているんですね。
はい。そうですね。この業界の CAGR、成長率とか、例えば、FA とか製造装置機器メーカーの成長率などと比べたら、どえらい違いが出てきています。まさに成長分野。そこにアドバンテック抜け目ないですよね。自社ながらしっかりテレヘルス需要に対応できている、そういうカートを出してますよね。
そうですね。木下さん。遠隔で映像をつなぐには、何もここまでしなくても、今ならタブレットや PC があれば、このカンファレンスみたいにできるんですけども、医療の現場を考えてみると、こういったカートでパッケージ化された方が確かに使いやすいですよね。
はい。高精細なカメラだったり、さらにはオプションで幹部の細かなところを映し出す内視鏡とかもシステムで連携していて、遠隔のドクターからの指示で簡単に診断できるパッケージとして製品化されていますね。
はい。でもこの製品って、アドバンテックは病院に直接販売してるんでしょうか？特にここ、日本国内ではどのような形で採用利用されるものなんでしょうか？
はい。村松さん、鋭い質問です。そうなんです。アドバンテックはハードウェアプラットフォームのプロバイダーです。ですから、システムのインテグレーションだったり、フィールドサービスを伴った医療機関へのサービス提供はできません。そこは、医療系のシステムインテグレーターの方々とのパートナーシップによって実現できます。日本の場合、この市場、そしてこの製品はこれからのものですから、私たちアドバンテックテクノロジーズとしては、日本国内でこのシステムによるビジネスの開発であったり、サービスの提供をしたいと言われるパートナー様を募集しているところです。
なるほど。システムインテグレーターさんとフィールドサービスですね。
はい。
そういったテレヘルスビジネスを進められている企業様がおられましたら、ぜひ弊社にお声掛けいただけたらというふうに思います。よろしくお願いいたします。
お願いします。はい。それでは次のトピックに移りましょう。次は医療向けのモニターと AI に関わるお話になります。村松さん、医療の現場っていろんな場面でモニターがありますよね。
はい。
さらに、診断画像など、最近では AI を活用して分析の精度を高めたりとしている。そういった話は、当たり前化している話かと思います。
そうですね、木下さん。私も先日腰を痛めまして病院に行ったんですけども、レントゲンとか MRI とか、そういった画像を何回も見ましたね。確かに最近はそういった 画像をモニターに綺麗に映して説明するような場面も多くなっているようです。
そうでしたか、村松さん。そういえば、腰を痛めて前回のイベントの時も、クッションのせいで、座高が、こんな感じですね。やばいことになってましたよね。もう大丈夫なんですか？
はい。ご心配ありがとうございます。大丈夫です、木下さん。その辺のお話、あれだったらもう少し詳しくしましょうか。
いや、村松さん、今日は内容がてんこ盛りなので、無理。
はい。
もし聞きたい方がおられましたら、その時にどうするか考えたいと思いますので、進めていきましょう。いいですね。
いや、それはまた失礼いたしました。承知いたしました。どんどん先に進めていきましょう。
はい。